I'm Monica Robbins with your top 3 health headlines. A new study shows that teenagers and young adults are using chatbots for emotional support. The study in JAMA Pediatrics finds nearly 1 in 5 young people surveyed used artificial intelligence to get mental health advice when they're struggling. 40% of those teens do so at least once a month and consider the advice helpful and non-judgmental. Experts say chatbots should not be substituting in-person mental health care, and there's no evidence chatbots have long-term positive outcomes or reduce symptoms of anxiety or depression. The American College of Obstetricians and Gynecologists updated its maternal immunization schedule, saying pregnant women should receive COVID-19, flu, RSV, and Tdap vaccines. The organization says its recommendations are based on scientific evidence and are designed to give doctors and patients a trusted source of guidance. The schedule is endorsed by more than a dozen medical organizations, and the new guidance comes amid ongoing debate over federal vaccine policy. Last year, the Department of Health and Human Services removed COVID-19 vaccines from its recommendations for pregnant women. A new study finds nearly 1 in 3 middle-aged Americans struggle to understand basic health information, including how to properly take prescription medications. The research of 900 patients is in the Journal of Internal Medicine, and it found many had difficulty recalling information from a doctor's visit and correctly interpreting prescription labels. Experts say confusing instructions and inconsistent labeling can lead to medication mistakes, such as the wrong dose or mixing drugs improperly. Patients need to ask more questions about treatment plans, and communications need to be more clear. And don't skip the weights next time you're at the gym. A new study suggests strength training may help you live longer. Researchers reviewed 30 years of data from more than 147,000 people who did 90 to 120 minutes of strength training a week, and they saw a 13% lower risk of early death from any cause. However, the study only shows a link, not cause and effect, and it relied on self-reported data from mostly older white adults. So the authors say more research is needed. However, still not a bad reason to hit the gym. Read the study in the British Journal of Sports Medicine. I'm Monica Robbins, and that's your Daily Dose.